Able to. Yeah. Hello, everybody. Due to the weather, we don't seem to have too many in-person attendees, but we do have some attendees online who I hope will enjoy the presentation. Want to say hello to everybody out there in District 3, whether in person or online. And welcome everybody to the Countywide Area Plan for older adults, the District 3 edition. We have been holding public forums in each of the 5 county supervisorial districts. I'm Kim Fogel. I am the Senior Planner of the Social Services Agency, Area Agency on Aging. I am 62 years of age. Thank you so much, Supervisor Tam, and your wonderful staff, the San Leandro Veterans Memorial Hall, and most of all to everybody who is attending in person and online for taking part in this public forum for the Countywide Area Plan for Older Adults. A few housekeeping notes, then we'll dive right in. Restrooms down the hall and to the left. Food is over there. We're delighted to have with us, both in person and online, interpretation in Spanish and Cantonese. Headsets for translation are available. And because we are privileged with simultaneous translation, fast talkers like me have to be mindful and moderate of our talking speed so that everybody can be included in the discussion. If anyone in the online audience would like to choose an interpretation channel, there is a small globe icon at the bottom of your screen. Click on that and it will reveal your choices. Please sign in if you haven't already, and keep your door prize tickets handy since we'll be giving away a few goodies this evening. And when you're on your way out, please make sure to take a bag we made up for you of some useful items. And just a quick reminder that a core value of Alameda County is respect. We may disagree, that's healthy, but we always address each other respectfully. So why are we here? First, Alameda County has joined the network of age-friendly counties, that is, cities and counties preparing for an increase in residents who are older. Second, every 4 years, the county comes to the community and asks for input to prepare the Countywide Area Plan for Older Adults, also called the CWAP. That's why you see our team wearing these t-shirts. And that is the county's strategy for providing services for residents age 55 and over, and bringing Alameda County closer to our goals as an age-friendly community. If you're an Alameda County resident, 55 or over, or you're a caregiver, family member, friend, neighbor, not to mention looking at your own future, your voice is needed for our community to grow even more responsive and supportive toward older adults. But to start things off on the right note in every sense of the word, would you please welcome District 3's very own Keith Barros, who has something special for us right now.
Oh, hello. Hello. I don't know if I'm going to be standing in the right place here, probably, I guess, right about here. Okay, well, we're going to start this with something happy and cheerful despite the weather out there, okay? So this is a song that was originally recorded like 1932 or something, Cab Calloway. A lot of people have recorded this, Sinatra did, but I'm going to do the happiest version of it, rendition that was done by Michael Bublé. So I'm going to do that one. Maestro, if you please. Oh yeah, there'll be a time to clap. I've got the world on a string. I'm sitting on a rainbow. I've got that string around my finger. What a world, what a life. I'm in love. I've got a song that I sing, and I can make the rain go just by wiggling my little finger. Lucky me, can't you see? I'm in love. Life's a wonderful thing, as long as I have a one to of that string. I'd be a silly so-and-so if I should ever let it go. I've got the world on a string. I'm sitting on a rainbow. I've got that string around my finger. What a world, what a life. I'm in love now. Only 16 claps. It's not asking too much. You're getting down there. Getting close. All right, that's enough. Life's a wonderful thing as long as I hold on to that string. I'd be a silly so-and-so if I should ever let it go. I've got the world on a string. I'm sitting on a rainbow. I've got that string around my finger. What a world, what a life. What a world, what a life. What a world, what a life. I'm in love. I have definitely fallen in love. Thank you. On with the show.
Well, I almost didn't come back up here because that is one tough act to follow. But I know that we're all looking forward to hearing a few words from about the big picture of life for older adults in District 3 and some of the topics we really need to think about. And to help us see the big picture, please welcome the Honorable Lena Tam, Alameda County Supervisor for District 3.
Thank you, Kim. I know social services has been very busy organizing a number of these forums. In fact, they probably have one simultaneously right now in District 1, but I have to say, no other district has a Keith Barros, right? So we have our very own. So I am very honored to represent District 3. Alameda County has 1.6, a little over 1.6 million people, and the portion that I represent in District 3 includes all of the city of San Leandro, all of Alameda, Hayward Acres, San Lorenzo, and portions of Oakland, the areas around Jack London, the airport, Fruitvale, Chinatown, and Little Saigon. Those are the areas in Oakland that I represent. And one of the unique things about my district is that we have a higher proportion of older adults. In Alameda County, we have about 13.9% of people over 65, but in my district, we have about 16.5%. So this is a unique population, and we want to be able to serve this population. In many cultures, especially in my culture, the Chinese culture, the older adults have taken care of the young ones, and I hope I'm the young one. And it is our duty to take care of you, the older adults. And we at the county provide those safety net services, so we want to hear from you what kind of needs you have and how we can better take care of you. And Serena Chen, who is my senior policy advisor, she's prepared a PowerPoint presentation to just kind of keep us grounded, to understand who we are and statistically what we look like and how best to meet some of our goals. So take it away, Serena.
I'm only a senior policy advisor because I'm a senior. Whoops. So Alameda County has 343,000 people who are over the age of 60, and that is kind of like a little bit like the size of Oakland. So there's a lot of seniors in Alameda County. And if you look at the darker colors are where there's a greater concentration of seniors in the county. And you know, it explains itself. So San Leandro is 16.4. Okay, San Leandro is 16.4% seniors. Alameda is 16.6% seniors, and Oakland is 13.3%, but if you look at the numbers, there's more seniors in Oakland than there are in San Leandro and Alameda combined. I'm just playing with numbers. So District 3 is where I put a little circle around it in a very inexact way. But if you look at the colors, this is life expectancy. So the people who live in the red areas, their life expectancy is 80 years or less. The yellow areas are between 80.8 and 82.5, and the green areas are 82.5. So we're all going to move to Bay Farm Island in Alameda. I mean, but what it says is, you know, the likelihood of you getting to that age is better in certain communities than in others, so not everything is fair. But one of the new ways of measuring how well a community is doing is the Healthy Places Index, which you could look up, and you could look up your own zip code and your own census tract, and you see that even though there are some areas in the previous map where it didn't look so good, the areas that are green here, according to the Healthy Places Index, are doing better in terms of economic, education, et cetera, opportunities. And the blue areas are the ones that have the least number of those conditions. So, you know, we feel like this kind of measurement helps us see where we need to put more effort into improving people's communities so that we can all live up to that 84 or whatever it is we want to live to. County government is the social safety net. So we're the ones who's supposed to be there when no one else is, or when people have really fallen down. So this map you see is of poverty in Alameda County, and the darker the color, the greater the percentage of people who live in poverty. And living in poverty is a little over $1,000 a month. So, you know, it's very, very poor. And you can see that here in District 3, the parts of Oakland, close on the west side of the, you know, I never know north, east, south, and west because they make the maps really weird. But to me, it's kind of like this away, right? In Oakland is where we have some of the poorer areas where up to 54% of the population is below or at the poverty line. So these are just kind of the depressing pieces of data. Their poverty levels using the Elder Index. So 1.5 million older adults, 65 and over, don't have enough income to meet their basic needs. 34% of older adults, 65 and over in Alameda County, don't have enough income to meet their basic needs. And a single older adult who rents in Alameda County needs at least $36,000 a year to meet their basic needs. And that's, you know, that's over $3,000 a month. And in terms of in-home supportive services, in Alameda County, 16,000 older adults receive IHSS services, and 388 blah, 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 older adults statewide receive those services. Homelessness. I didn't realize this until I dug up this piece of data, but 45% of the people who are homeless in California are over the age of 50. So, you know, just when you think you're supposed to be safe, and you have a safety social net, you're not. I mean, if you look at the fact that almost half of the homeless individuals in California are homeless. So in Alameda County, 2,700 adults 55 and over have interacted with the homeless response system, which doesn't mean they're homeless, but it does mean that they've had to call. I mean, it's good that we have the resources, but these are the number of people, individuals who have called seeking support and hopefully, not falling through the cracks. So the state of California puts out these 5 bold plans for 2030. Number 1 is housing for all ages and stages. Number 2 is health reimagined. We have to figure out what is a better way to make sure that everybody can access health care and behavioral health. Number 3 is inclusion and equity, not isolation. I think COVID really taught us how narrow our social safety net is, in that you're home a week and you haven't talked to anybody, you start to feel a little batty. And there were a lot of folks in the county, and in the country, that really suffered from this social isolation. And so, it's important that it's like goal number 3 in the state, where they recognize that there's this isolation. We need to. We need to. Am I talking too fast?
No, my computer started talking to me in Spanish.
This is why we're afraid of AI. Goal 4 is caregiving that works. And goal 5 is affording aging. Yeah, we'd all like to afford aging. I mean, a lot of people don't retire because they can't afford to. So I don't know about you, but some of us are baby boomers. Any baby boomers here? Okay, I remember when we were actually young, and they told us we were like a pig that's being swallowed by a python. And basically, a python just goes out and grabs this pig, and the baby boomers were the largest cohort, age group, born in the United States ever. So what happened is that wherever we were going down this snake is where we kind of influenced society. So, baby boomers didn't invent these people, but basically they kind of changed what society liked or didn't like. The cutting edge of baby boomers were the Elvis people, and then there were the Beatles, and there were the Rolling Stones. But as we moved down this snake, we really influenced what society deemed was important, because we were the biggest thing there. And even though some of our numbers have been diminishing, we still are the biggest thing moving down this snake. So we need to really tell the county and let the state and the county know what our issues and concerns are, and share what our parents or whoever we're taking care of issues and concerns are. And that's why we're having these forums, because every one of us, we shaped society, we shaped American society with who we are. At least I like to think so. And so basically, we need to shape and we need to show the state and show everybody that we are still visible. I know that once you hit like 40 or 50, of course with Keith never, but we become invisible. People don't really see older people. And these forums are an opportunity for older people, older adults, to be seen and to be heard. So that's it. And you can always contact us at the District 3 office. And thank you very much. I hope there are a lot more people at home.
Thank you so much, Serena Chen and Supervisor Tam, for that really important perspective, which really encapsulates why we're here today. Next, we want to show you a brief public service announcement that we hope will further introduce the Countywide Area Plan for Older Adults and the county department bringing it to you, the Area Agency on Aging. We're also known as the AAA, or you could think of us as the other AAA.
If you're an Alameda County resident,
Yeah, we're not hearing it out here either. They're fixing it. Okay. Ask folks to stand by. It works beautifully.
if you're an Alameda County resident age 55 or over, take part in a survey that will ensure our countywide area plan for services to older adults reflects your needs, your views.
Look for the survey at senior centers, libraries, and community events, or scan this QR code to take it online. For more information, call 510-268-2927.
The countywide area plan for older adults.
Your plan, your voice. Thank you. I hope you enjoyed that as much as we enjoyed making that. And we hope that gives you a better idea of what it is that the AAA does and what the Countywide Area Plan for Older Adults is for. And now I am really pleased to introduce the facilitator for today's discussion, Ms. Connie Soriano, Supervising Program Specialist for the Area Agency on Aging. And I'd like my scribes to, if the scribes could take their places. And Connie will explain more about what the discussion's about.
Hello, everyone. Again, my name is Connie Soriano, and I work for the Area Agency on Aging in Alameda County. We sit under the Social Services Agency. The Alameda County Area Agency on Aging, also known as the other AAA, is the local arm of the National Aging Network, designated by the state of California to address the concerns and needs of all older adults ages 60 and older in Alameda County. We advocate, offer services, and contract with local providers and community partners to advance the social, economic, health, and well-being of older adults. So by making an extensive range of supports available, such as home-delivered meals, transportation, family caregiver support, and other resources that make independent living a viable option in Alameda County, the AAA makes it possible for older individuals to age in place and in the right place. So let's begin our discussion today. The first question we have is, what makes Alameda County age-friendly right now? That's the first thing that we like to talk about. And I'm asking anyone in the audience or anyone who's joining us virtually to provide your first name, your city, your age if you want to, and if you can tell us in one or two sentences, name one thing about what you like about where you live right now and why you feel where you live right now is age-friendly. Any takers? Yes. Hi, Keith.
Keith Barros from San Lorenzo.
Thank you.
I'll start. This is not under government control, but the first thing that comes to mind is the weather and the climate here in this district in the East Bay. I've lived here my whole life, and we're so spoiled with that.
Yes, we are blessed.
I live in San Lorenzo. It's basically a bedroom community. Not a lot of retail, not a lot of industry, of course. And we have a home association there. It's relatively peaceful. The transportation is there if you need it. There are bus lines. We're not too far from BART. We have access to 880, 238, 580, You want me to start over?
Sure.
Okay.
Thank
well,
you.
All right. I just wanted to start by saying that the weather and the climate and the weather here in the East Bay, I love it. I lived here all my life. It never gets too hot. It never gets too cold. As a song that I wrote one time says, the weather here is more pleasant than in Pleasanton. Aside from the climate, I live in San Lorenzo, and it's basically a bedroom community. There's not a whole lot of retail at this particular point in time. There used to be a lot more than what there is now. We're working on that, but it's basically a residential community with a little bit of retail, grocery store, fast food, that kind of thing, and a strip mall or two. But transportation there is readily accessible. If you need to take the bus lines go through there, BART is you could walk to BART really from San Lorenzo if you wanted to, but it's a short bus ride. We have and there's automobile access to Highway 880, 238, and 580. You can go in any direction and get to any of the cities here in the East Bay, or even beyond, relatively quick. And we have a home association in San Lorenzo, and it is, I think, quite a bit of the reason that it's such a nice place to live. It's quiet. People, as a general rule, take care of their properties, and we all know that if you're willing to move in there and take on a few extra rules, you're probably not a scofflaw, so or a lawbreaker.
Yeah.
So anyway, that's why I like living here.
Thank you, Keith. You packed in a lot in there. What I heard here was, well, you did mention weather. First and foremost, we are very thankful for the wonderful weather that we have here. You mentioned also, I heard you say peaceful community, so that's kind of like peaceful. I kind of equate that with safety. But the more important thing that you expanded upon was transportation. We have readily accessible highways that we can, go by car in either direction or any direction actually. And then you mentioned bus, and then retail and other businesses that are kind of starting to pop up in close to residential. Yes.
One more quick thing.
Yes.
Quality of life I forgot to mention. I'll say it loud so you can hear me.
Okay.
We are fortunate enough to have our water supplied by East Bay Municipal. We are fortunate enough to have our water supply by East Bay Municipal Utilities District. It's the greatest tasting tap water that I've ever tasted anywhere. And if you don't believe me,
Yes.
just drive to LA.
Yeah. And another great point about our quality of life up here in Northern California, or specifically in Alameda County, is East Bay Municipal Utilities District. Our water is excellent. So thank you. Thank you again. Do we have anybody in the virtual? Yes, Janine. Hi, Janine.
Only online, and they really can't hear you without the mic. So
Okay.
everyone, please let us run over to you.
So my name is Janine. I actually do work for the county. I operate the senior information line in Oakland at Eastmont Mall. Basically, seniors and persons with disability can call us for resources and and programs that will assist them stay in their homes and independent, whatever level they're living. But I also am a child of the 60s. I'm one of them baby boomers, and I do remember growing up that the weather was great, and it was great to have grandma and grandpa around. But I think for me, what I like better now is there are better resources, connections, senior centers, adult daycare, things like that. Because I do remember as a kid, you'd have grandma, and grandma had a stroke, and she had 3 adult children, and so it was the kids take care of the parents because they had nowhere to go. So I remember my one friend. It was her great grandma. She would spend 3 months with one daughter, 3 months. Break it up. And they were responsible for taking care of all the needs, whether it's diapering or feeding or whatever, and that there was really no other resources to turn to. And the one nice thing about coming into, coming as the time going on, is that there are more resources out there. They're not all that we need, but they are at least a lot better than they were in the 50s and 60s. That there is an awareness that we are aging and that we do need help. Not perfect, but it is better than what it was when I was growing up.
Thank you, Janine. So thank you for that elaboration. What I'm hearing is better resources and connections, such as senior centers, daycare centers, basically external support and resources that are available as we age in our community. Thank you for that. Yes, hi. Microphone.
Oh, yay. Okay. I got it. Okay, got it. Thank you.
Hello, my name is Amelia, and I live here in San Leandro. So I'm on the younger end of what's called a senior here in San Leandro, because as soon as you're 50, you can go to the senior center and participate in all their activities. But what I have seen is, yes, they have in San Leandro a senior center with different activities for people to do, everything from playing table tennis to dancing, learning how to play the ukulele. They have bingo. They have lots of different things for people to do. I've seen, not that I'm not old enough yet to use it, but I have seen different shuttles in the city, something called a Flex shuttle, and there's another one that I don't know the name of, unfortunately not yet anyway, but it looks like there are things that people can use if they don't happen to live near the different facilities that they want to go to. I believe they help people get to doctor appointments,
Okay.
or possibly areas where they might
It's
need
like
to
East
shop.
Bay Paratransits, perhaps?
Yes, I believe that's what
Okay.
it's called. Yes.
East Bay Paratransit.
Yes. So as far as aging, if this is what it's referring to as far as age friendly, I would think that, not having to stay home if you no longer drive, which is definitely something that seniors don't want to let go of. Although I have seen a lot of people that shouldn't be driving anymore. Oh
And
my
that's all
gosh.
ages.
But as far as making sure that people can get to where they need to get to, it sounds like at least there are some things in place. Yeah. And they do have a lot of, I see at the senior center, I've seen that they do have food available for people who might not cook anymore, or maybe they don't have enough money to get the groceries that they need. So those things, I would think, help people out in the city.
Thank you, Amelia. There was a lot in there. You mentioned senior centers with a variety of different types of activities. What I heard also was ukulele lessons, if you wanted, as well as other activities that may appeal to you. You mentioned Flex shuttles, East Bay Paratransits, roaming around the area, getting people to where they need to be for their different purposes. So there are options to not have to stay at home. And I think what I'm kind of summing that up is mobility, having the ability to be mobile. Transportation, mobility options. And you also mentioned food resources too. So that's a huge, huge piece. So yes, making those available to all, especially our older adults who may be homebound or in need of extra food resources. So thank you for that. Okay, well, I'm gonna kind of summarize what we have here, some top ideas. And then I'm gonna ask everybody to kind of, as we're going through this, to help me pick out 3 of the top items. And we'll put a little star by them, but I'll start by naming off the top items. Oh, thank you. And unfortunately, my eyes are really bad, but I have my notes here too. Okay, I can take that off? Okay, excuse the, thank you, Julie. Okay, so here in Alameda County, we are blessed with wonderful weather and climate. We love it. It is peaceful here, so we have a sense of safety in our communities. Transportation, readily available. We have highways that can take us in any direction. We have Accessibility, we have access to retail near our residences. We are also very fortunate to have East Bay Mud, which is the greatest water anywhere, arguably so. We also have better resources and connections now than we have in the past to care for seniors, such as senior centers and daycare centers. One that was mentioned was San Leandro Senior Center. We have shuttles, like a flex shuttle, ride services, as well as East Bay paratransits. And the whole idea, again, is the mobility piece, keeping people, or having options for people to not just have to stay at home. And also an important piece is food, the availability of food resources. So there was a lot there, but the question now that I ask is, can you please help us identify the top 3 age-friendly, what makes Alameda County age-friendly? The top 3 things that, in your mind. Yes.
Okay.
Yes.
Yeah. First of all, I'll vote for the better resources. That last item that you put down.
Better
there.
resources
The
and
better
connections.
Those resources are extremely important for aging, people who are aging.
It's almost become almost like a science, like kind of studying what is needed, doing needs assessments such as what we're doing here, surveying, finding out what those needs are, and then being able to also provide them, implement programs, bring those into the community. So we have a heart near better resources and connections. Anything else that kind of resonates with you as one of the top reasons why Alameda County is a great place to live? Location. Oh, location, yeah. Location, there's a lot of overlap with a lot of things here. We have the weather, we have, the ability to travel to different places because of our highways and because of our transportation system, our shuttles. So there's a lot of things, just again, the location.
I might want to add something to
Yes.
the resources. We have lots of, adult schools. Even we can take classes, all kinds of classes at Chabot College, and I'm sure other colleges around Hayward Area Recreation District also, and East Bay Regional Parks. I mean, there are just a number of different resources that there are probably more, but I just thought of those
Right.
that should be added to the list, I think.
So just to kind of go along with the better resources and
Yes.
connections, not only just for those who need it as we age, the support that we need, but there's also education, also, parks, just to kind of enjoy the outdoors with all ages. Let's see here. I see something being starred over here too. We highlighted when it was first brought up the food availability. That was also like a huge, huge resource.
Our paratransit, which I know people don't love, but it connects 9 counties, and it's pretty impressive if you've been to other parts of the country where they don't have it. So that's a pretty good thing for the Bay Area to have.
Yes, it does. Yeah, the Bay Area. A lot of overlap. A lot of overlap with what we're hearing here as some of the top reasons why Alameda County is age-friendly. I see, Janine, you want to point something else out?
Yeah, going back to accessibility, I also think the bus systems, because, when I was growing up, you had to go on the 2 steps to get up to the bus, and now they actually have the lifts that go down, and it allows for wheelchair access, and they have locks so that if wheelchairs if they stop quick, they're not thrust forward, and I think that it's allowing mobility impaired people to get out there and get around better.
Thank you, Janine. Along with the accessibility, it's also not only accessing it, but also having the ability to be mobile. Resources and better connections. Let's see here, just the location that we live in, we have just a variety of, again, resources, connections, accessibility, mobility, and that there's also food resources too. Okay. All right, I'm going to move on to our next question. Let's all take a look into the future now. And if we could have, so the question is, what would a more age-friendly Alameda County look like? So I'm going to ask everybody to close their eyes for a moment. No napping, please. And then please imagine going forward in time to 2028. That's 5 years from now. Create a mental image of what you would like to see. Put yourself in the picture. What is happening? How are you involved in it? What is different than in 2023? And how does this mental image that you have in your head help you and the people you care about live more fully? Okay, so kind of take a minute or a few seconds. Okay, so does anybody want to share what their mental image looks like?
I think safe, affordable, accessible housing, the most important thing.
You touched upon many key words in there: safe, affordable, accessible housing. That is for sure. Yes, Luna.
I would like to also bring up the issue of isolation. Due to COVID in the last few years, it has really heightened the issue of isolation with our seniors. So I would like to see in that future a more community focused type of living situation where we're more conscientious of our aging community, that we can come together and form maybe some type of efforts so that we can take care of our aging seniors. Maybe depending on living, where we live, taking turns. I don't know, more engagement like the old times as Janine was bringing up in the past. You know, it was just more community focused back in the days. And I think I would love to see that in the future where we're more engaged and we can take care of our seniors.
Thank you, Luna. Thank you for bringing up the topic of isolation, especially as it was heightened during our the COVID pandemic. You mentioned having more community-focused minded resources and being more conscientious of our aging community. I guess I can sum that up as kind of more involvement, more community involvement and inclusion of all ages, especially our older adults.
Having more awareness. I don't think I heard about how isolation was an issue until I came here to this department.
Thank you. Yes, isolation was a big issue, and then engagement and awareness as part of that future solution.
And then to top off the isolation, you know, I do remember back where you could take a walk, you know, and not be afraid that you were going to get carjacked or be robbed at gunpoint, or, you know, that you could walk the dog and you didn't have to be scared. And so part of socialization is getting out to places. So like I still definitely use the bus, and sometimes I come home a little bit later at night, and I used to just would get off the bus and come home. Now it's kind of that fear of who's lurking around cars, who's lurking around and I'm not even being, you know, like paranoid, you know. I'm you know, it's really, I have a flashlight now that I flash it around, and I intend to use it if somebody decides to get a little fresh. But I do miss the times, and I understand people are suffering economically and mentally and through drugs, but still, it is my right to walk down the street and not feel scared. And I would like to see my safety, better safety for everybody.
Yeah, no, you mentioned a great thing, Janine. Part of socialization is getting out and about, and having that peace of mind. Safety is a big concern. Safety is something that we should be addressing in the future. So thank you for that. Do we have anybody from our virtual, who is joining us virtually, who have any input or feedback? I'd like to invite you to provide any feedback you may want to share. Yep,
we do, from Spectrum Community Services.
Okay.
Go ahead.
Oh, there it is.
Yes, we can hear you. Thank you.
to go hungry. So what we were able to do was we're able to incorporate a online socialization opportunity for them. So they can come and pick up their meal and go home, and then they log on and they can do different activities. Sometimes, like on Fridays, those are my favorite, they do a world tour, and they're interactive world tours, and they'll go see the Louvre in Paris, and they can talk to the host and ask questions, and it's a way for those seniors who don't feel comfortable to be in a group setting to still have some socialization opportunities through virtual experiences. So I would love to see us be able to explore, more things like that moving into the future.
Thank you for sharing. Yes, so, and also thank you for sharing some of the resources that Spectrum has available to the community. Online socialization, that definitely sounds like that is something new age, but it is actually available right now. And also just an increase in the use of technology and comfort with using technology. So thank you again for sharing that. Okay. Anybody else want to add anything that comes to mind? Yes.
As far as age-friendly, going back to the streets, I would say we need streets in which people can walk safely because too many people are getting hit by cars. So when you're crossing a street, it's almost as though you're dodging cars. And some of that is, even if you might have the walk sign, what'll happen is a left turn light will also go green for the cars on the opposite side. So you might still have time left on the timer for walking across the street, but then the vehicles also have a green light to turn left, and you might not be finished. So I know to walk really fast across the street, but I don't think everybody is able to do that. So I don't know if transportation can coordinate the crosswalks so that the pedestrian has no danger of being approached by a car. 'Cause that would really help, I think, when people are crossing streets.
Thank you, Amelia. You bring up
You're
a good point. Pedestrian safety, street safety. Maybe that would be in our infrastructure planning, perhaps, or maybe just building awareness or just better coordination and planning ahead. So thank you. And that's with respect to pedestrian safety or just street safety in general. Okay. Thank you. Again, the question was, what would a more age-friendly Alameda County look like? And together we have come up with several ideas for the future. Feedback includes safe, affordable, accessible housing. Another one was awareness of isolation, taking care of seniors, programs such as one that Spectrum has, which is the online socialization program that gives opportunities to seniors through the use of technology to connect folks. That would be nice to see in the future. And just being more mindful and engaged so that our older adults are not isolated. We also brought up the idea of peace of mind, having peace of mind in our community, just general safety. Let's see what else. Oh, also we mentioned pedestrian safety, coordination of street lights, or just kind of being mindful of the planning and infrastructure of crosswalks. Okay, so with these items, did I miss anything on this side? Okay. Oh yeah, you guys are in sync. Use of technology, increased use of technology, and again, safety. Okay, so my other question, yes, Keith. Yeah, it's right behind you.
And then this has probably already been done, but I don't go to the senior centers yet, anyway. And perhaps it's a resource for something like this. But I'm just thinking it'd be nice to have like I don't know, give it to somebody on their 50th birthday or something, but like kind of a senior package or packet of that gives a senior person at least a location or a list or some type of listing or resource or pamphlet or something that shows all the kinds of things that there are available that they can do, all the things that we're mentioning here. I mean, it would be I mean, most people don't know that there are these many resources around, and some of us need it more than others, and hopefully this idea already exists, but it just popped in my head, so I thought I'd.
We have,
Oh.
yes, we have a senior resource
Okay.
guide.
Great.
Yeah,
Right,
but just
online.
getting the word out.
Yeah.
Yes, there's a senior resource guide, both hard copies that are available and sometimes mailed out at different senior centers, but also it's available online, as Laura had mentioned.
Okay, good to know.
Yeah. But you're right. Having a comprehensive list of all the resources, all the wonderful resources that we have available in Alameda County, and making sure that there's awareness around that, just spreading the word that these resources are available and that there's a list available as well.
For the
Yeah, and they
people
exist.
that don't live in
you.
San Leandro, you usually get the Hayward Area Recreation Department guide. And in there, usually they list all the different activities for seniors that you can take at the different locations. Because Hayward has one senior center near the little Japanese garden. They have another one in South Hayward that I'm aware of. And there's another one near Meekland. So there's a lot of them in the Hayward area department. And for the people that live in San Leandro, the Park and Rec guide has a lot of these things listed in it. Yes.
Thank you, Amelia. You're right. The City of San Leandro, as well as the Hayward Area Recreation and Park District, puts out an activities guide. Maybe I think it's quarterly, and it has a wealth of not only classes but also different resources, phone numbers that can connect you. But just again making it accessible so that everybody knows, and just that some communities are better at distributing it. So just across the board, having that knowledge of where to obtain information on resources. That's kind of key. So let's select 3 ideas that seem the most important, and we'll put a little star or a heart next to it. Does anyone want to raise up any of these items that are here? So the question again is, what would a more friendly Alameda County look like in the future?
I think we need to start with feeling safe.
Okay.
Being and feeling safe.
I'll let you repeat that, Keith.
I would like to start with feeling and actually being more safe than what we are today. Safety first.
Right. So it's not just about safety, but it's the feeling of being safe, feeling safe, the peace of mind that you have with feeling like you're in a safe community, having safety. So thank you. So some of the items, safe, affordable housing that's accessible for all, addressing the isolation.
Yeah, that would bring me to my point of
Safe streets. Oh, yes. Hi.
Are you still on the safety question?
Yes. Okay. Yes. Oh, she has the microphone. Would you like?
No, if you're not finished with safety, I'll wait.
Oh, okay. No, we are. Yeah, I was just kind of repeating some of the topics here. What would a more So this question has to do with what we would like to see in the future. What would a more age-friendly Alameda County look like in the future is the question.
So I'm thinking more free activities for the elderly and the disabled. A place for people such as ourselves to gather without the impediment of financing.
Thank you. So breaking down the barriers by making available free activities for older adults and those with disabilities. So.
Right. On a regular, if not weekly basis.
Okay.
Hopefully more than once a week.
On a regular basis. Yeah, that was key.
And for those who are night owls, who don't sleep at night, some late evening activities.
Yes. So
instead of just early mornings.
So late.
Or you know, before 5 activities, after 5 activities.
So
Not that we want to get drunk.
More
but
options for activities. And we're talking about maybe evening or into the late nights. Yeah. Thank you. Okay, so thank you for sharing. We are now pointing out 3 of the top items that make Alameda County, that you would like to see in Alameda County that would make it more age-friendly in the future. So we talked about safety, such as, you know, the sense of, the feeling of being safe, as well as safe streets for all, whether you're walking or you're in your home, you want to get out. Let's see here. So that's, I'll kind of lump that together as one, and we could put a lot of sub-bullets underneath there, but yes.
Since some of us don't necessarily have family, we're like essentially alone, or our family are distant. Since there's such a high need with the youth, how about pairing the seniors with youth for mentoring? Those who have that capability, offering such programs, not just for mentoring, but, you know, we can keep each other company and keep each other occupied, and therefore the temptation of the youth having too much free time, nothing much to do with it, getting into trouble, would alternatively keep us safe also and form the bond of community that is much
I
needed.
like how you put that, forming the bond of community, pairing seniors with youth.
And that's for in schools too. How about starting, you know, a lot of us have time we can donate if we don't have anything else. We do have some time. And fostering some kind of program, whether after school or in school, some way with the youth.
Thank you. So you'd like to see more opportunities for maybe what we call intergenerational connections, such as pairing seniors with youth or school-aged children for tutoring or just kind of mentoring, but also giving options for the youth too, to kind of stay out of trouble. So thank you for bringing that up. Okay, so we now have a full list. Do we want to put a star or a heart, whatever we want to do, to indicate our top 3 things that we'd like to see in the future? What would make Alameda County in the future more age-friendly? We have safety being one of the biggest things, and under safety there's many little sub-bullets that include like pedestrian safety, the sense of feeling safe. We also talked about isolation. I saw that. Maybe we'll just put a star next to that one. Isolation was brought up multiple times, and there's multiple themes of isolation, how to address isolation. You had mentioned in the back just pairing seniors with youth, having those opportunities available. And also, Luna had mentioned just more involvement, more inclusion, engagement, awareness, so that we have a more connected community, more community focused, more conscientious of our aging community. So isolation was another piece. Was there awareness of isolation? Okay. Housing yet housed. Yes, yes. Thank you. Yeah, that was our. Yeah, that was the first thing that was mentioned. The person who mentioned that was safe, affordable, accessible housing. So yeah. Okay. Thank you. That was a lot of work. So I'm going to put a little pin in that, and I'm going to bring Kim up because we're going to do our first raffle. So all of the participants in the audience, when you signed in, you should have received one half of a raffle ticket. One went into a little container, and one you should have with you. So if you want to pull that out, we're going to do our first raffle.
How many ticket, I think we have 2 ticket holders here, if I'm not mistaken. Right. We have 4 oh, great. Okay, so then who has the raffle barrel? It's time for a drawing.
Luna, do you mind asking?
It's time to roll out the barrel. Don't lose sleep over the competition. Those days are behind me, I'm afraid. Oh. Okay. Drum roll. Yeah, you should have brought your drums. There you go. I have 279-615. Anyone have 279-615? Well, if this person's not here, then I think we should draw again. You must be present to win. I have 279-626. Okay. Oh, we've got something for you. We've already got something for you. Yeah. Okay, we're going to draw again because we already have something for Keith. Yeah. 279-617. Third time's the charm. Yay!
We have a gift for you. We have a gift for you. And thank you again to everyone here who's participating. We're not done yet. We're halfway through. Okay, so we have a clean slate up here. We're ready for question number 3. Lessons of the past 4 years. We've had an unusual past 4 years, to say the least. What are some of the most important lessons you want the county to learn from the COVID-19 emergency as we move forward into planning our countywide area plan? The countywide area plan, again, is our strategic plan for older adults for the next 4 years. And I'll ask some sub-questions. First, what did you find helpful from the county, your city, or other organizations during COVID, if at all? And what would you change about our approach, the county's approach to emergencies? Is there anything you'd like to add? Yes. Okay, thank you.
I appreciated the sites that were put out for testing and for immunizations during COVID. There were, a number of them. I would say, from this is, before they started going into the drugstores and such. I had within 2 miles of my home, I think I had probably 3 different sites that I could have gone to. So it was. I was very pleased with that response.
Thank you, Keith. So I would say, to summarize what you were saying, a coordinated effort for the testing and immunization of the COVID vaccine during this time as a response to COVID?
Yes, it was. I don't know what lesson could be learned from that, except I would say that I can't come up with anything that would say that they could have improved upon this, because it was very accessible. They had great hours, and then as it started to subside, they reduced their hours, and then then they're not there anymore.
Yeah, just feedback on the response if that was something that you found effective.
Yes, absolutely.
Yeah. Thank you. Yes.
Absolutely. Oh, and
Yes.
and also forgetting when you got COVID, they also responded, because I did catch it at one point. They also responded with I can't remember the name of the outfit, but they prescribed the was it Paxlovid or whatever it was. Got a Paxlovid, and got it like immediately.
Yeah, the worldwide community banded together to do the research, fast track all that research and get vaccines available. And our community was one of the ones who.
Yeah, and then the antidote to the disease too.
Vacation. Okay. Yes, Deara. Thank you. Do you want to introduce our online guest?
Spectrum, you are able to unmute.
Hi, it's Carol again. So as the development director, I want to talk about money. So during COVID, there was a lot of funds that came through. Even we as individuals, right, got stimulus checks from the government. but for me, and I have to write a lot of grants, the COVID funding really helped us because demand for services increased significantly, and we actually haven't seen it decrease now that the pandemic has dialed back. The nice thing about the COVID funding that we were able to get was there was a lot less strings attached to it. So a lot of times now when I have to submit a grant application, funders want us to create a whole new program, or they want us to do something new, right? But I still need to feed seniors, and the cost of raw food has gone up, and the cost of gas has gone up, and I didn't have to come up with a whole new program. I just could say, I need money to feed people. And so we did really well funding-wise during COVID, and so I would love to see, you know, that kind of funding continue, right, where there's less strings attached to creating a whole new program to get new funding. I need continued funding to continue what we're already doing. The other thing I wanted to say was, you know, I think that, you know, during shelter-in-place orders, we all got a taste of what it's like to hug people, you know, and so for me, being able to talk about the isolation and loneliness that face our seniors, especially our homebound seniors, like people get that a lot easier now than they did before pandemic. So, you know, like we at Spectrum, we did launch a new program called Connect, which is telephone reassurance calls and friendly visits and things like that, because I think, you know, we as a society now understand what it's like when you're isolated and how that can affect your physical health, your mental health. So, you know, it was one little silver lining in this is that, you know, I think we understand some of the issues facing our seniors better because of some of the things we went through this pandemic.
Thank you, thank you. We got some feedback again from our community-based organization. She talked about funding for programs and the mobilization of funds during COVID, how it helped a lot of the community-based organizations respond to community needs. And it'd be nice to continue to have those flexibilities in, you know, receiving future funds with no strings attached. So thank you for that. And also, you had mentioned lessons learned. One of the another topic, or actually the same topic again, isolation is brought up, and especially for homebound individuals, having that discussion, and then, you know, CBOs such as Spectrum have a program that kind of addresses isolation with their telephone reassurance program. So having, again, knowing what it's like, but also being able to implement programs and to continue funding those programs. Lessons learned from COVID. Yes.
I want to say, yeah, piggybacking onto that is, you know, I am part of a senior village, and I thought at the beginning nobody's going to learn how to use Zoom. People can learn how to use the technology. They need help and they need access, but seniors can get on Zoom and connect that way, and, you know, via other forms of technology, learn how to use it, take online classes. So yeah, and a lesson learned is to provide the support people need. We've done some of that, but we could definitely do more.
Thank you, Laura. One of the things that came out of COVID was the heavy use of technology to connect people,
Yes.
But also, you know, that there was education around that. So those who did not know how to use Zoom, such as, you know, applications such as Zoom, were able to learn and to be able to connect with one another. Having access to that also made available the opportunity to take online classes, education. So, yes, thank you. Okay. Any other important lessons learned? I see Janine.
Well, yeah, it's not so much lessons learned. I guess what it is for me is to keep the lessons going forward.
Mm-hmm.
And things like the social isolation. Because I'm thinking, you know, before COVID, people had their little neighborhood gatherings. They'd go to Pete's or Starbucks, or they'd go to the senior center, or they'd meet up. And then when COVID hit, people just lost track of people. They just disappeared. You know, there were no longer meeting at the coffee shops. There were no more sitting on the park bench visiting with your friends. You just didn't. And some of the people are alone. They're really alone. They've outlived some have outlived their children. Some have outlived their spouses, friends. That's one thing, because I had older parents, and that's one thing my mom had always said to me. She said, Janine, the hardest thing about growing old is that your social circle dies. But they don't just die or pass away. The whole traditions that you were raised with. You know, when she talked to me, I was talking about Starbucks. Well, she was talking about cooking coffee, and it was like you're on two different spectrums. So she really missed talking to her friends about their issues. And so, but if you are totally by yourself, and you fall or get sick, nobody knows about you. You're just, you're a victim of your own four walls. And so it would be nice, like you were saying, with the Connect, a way to have a centralized system where people, you don't necessarily have to know my whole world, but hey, I'm alone and I might need a call once a week, or just hey, are you still alive? And things like that. And with the technology is, to open more places where a person, I've learned Zoom. I mean, if I have my team here that keep me going. If I were up to me, that computer would be thrown clear across the room, literally. So,
Still are wonderful things.
Because I'm not techie. I've had more. The car and the computer are my two. Anything that goes wrong with the car or the computer, get out of my way. Because those are my two. Yeah. But anyway, just ways to get funding and get things going so that we can move forward and keep all that we learned from the past to become part of our future.
Yes. So thank you, Janine. You put that really eloquently. We are a changed world post-COVID. We're not the same. Our practices may not be the same. And just the lessons that we learned from COVID, we should continue to keep those in mind, keep the funding, keep those lessons alive through our programs and the funding of those programs. You had also talked about, again, the topic of isolation, connecting those who are alone. And you mentioned technology, even though it may be the bane of your existence, it is a wonderful, fortunate thing that kept us all kind of connected, or having that opportunity to keep us connected. Amelia, you have something to share?
I would say that one of the things which was a rude awakening for people is which jobs are considered essential. And the lack of essential workers. And there are still many jobs that are lacking the staff to be able to operate the way that they really need to. So the essential workers, the police, the nurses, everyone in the medical field, which was hit hard with everything that was going on. There's always a shortage of medical anything, nurses, doctors, all of those. So not to say that other jobs aren't important, but it was eye-opening to see which jobs we really need. People staffing the grocery stores, staffing the hospitals. That was major.
Yeah, no, thank you, Amelia. Again, I like the word you use, eye-opening. It's one of the lessons learned is that, what is the definition of an essential worker? Anything from police to medical or health workers. And you also mentioned, people who are working in grocery stores, keeping our businesses going, keeping us fed. So yes, those are good points and good feedback too. Okay, so I'm going to ask if there's anybody in our any of our virtual guests who want to add anything. If not, I'm going to do the same thing we did before, which is kind of raise up three of the top issues, or three of the top lessons learned from COVID or from the past 4 years. Does anybody have any feedback? Anything that stands out as numero uno, as important? All of it's important, I know. All of it's important. Okay, so I have, yeah, essential workers, yeah. And all of that is kind of tied to, what can we do in the county? And we do have like funding that is still coming in through, like, for example, we have a new source of funding called Public Health Workforce Expansion, and that's to kind of train CNAs. We recognize the need for certified nursing assistants in skilled nursing facilities, so being able to train them and to wrap around services to help them get through their training while they're, you know, going through the education process. So just those types of supports that are again, at all levels of the government. That's kind of some of the things that the lessons learned are reaching the government, those government heads making those decisions, and those funding opportunities are becoming available. So, okay, so we have testing. So I'm just going to summarize, and then we'll move on to our final question. So, most important lessons from the COVID emergency, testing sites, that the immediate response from the local government was phenomenal. It was impressive, and just that coordinated response was appreciated. Oh, I'm sorry. A coordinated response was essential. Funding and mobilization of funds for community-based organizations to respond to the community's needs. And to continue those programs through funding that is flexible, with no strings attached. We talked again about isolations that seniors face, mental, physical health. We discussed learning how to use technology, the opportunities through Zoom, yes, for education. Did you want to add something too?
Is there a committee within the county, besides you guys, what you're doing now, to coordinate, to implement this?
So we do have the Advisory Commission on Aging, and we're blessed to have our president here.
Who's the president?
Miss Laura, right here. Chairperson. Chair. Sorry to put you on the spot. No pressure.
Yeah, well, what the Advisory Commission on Aging does is basically oversee or advise the Area Agency on Aging, which receives funds from a number of sources to fund programs for seniors in the county. So right now, we're down to only 5 members. We can always use more members on the Advisory Commission on Aging. If you go to the Social Services website for the county, you'll find more information there. And yeah, what we do, like I said, is just advise and oversee and check in on what's going on with services for seniors in the county.
So I'm not sure my question was answered. You're a commission, and that's just kind of like for fact searching, or not even so much fact search, or just information searching. Where does the implementation take place, especially when funding is found?
Well, the funding is distributed through the Area Agency on Aging. So the commission is more just a consumer group to keep an eye on what's going on.
Thank you. I'm sorry. Okay. Oh. Yes, so the Advisory Commission on Aging also advocates for the use of the funding. Yes, did you? Okay, so I see where you're going with that. So within the county, the Alameda County Social Services Area Agency on Aging, for example, receives funds from the California Department of Aging, as well as other local, state, and federal funds. And what we do is we receive those funds, and then we're the fair distributors of funds. So we're not only maybe perhaps implementing programs ourselves through direct services, such as senior information and assistance. That's a service that we offer within Alameda County, but we also contract out with local providers or community partners to implement the different programs. So one of the contractors, or one of the community-based organizations that participated, Spectrum, who's joining us virtually, is one of the providers who's also receiving funds through the county to implement their programs. Oh. Wonderful. We have multiple community-based organizations joining us as well online. Thank you very much. Thanks for sharing that, Diarra. I didn't catch the second part of your question. I hope I kind of... the commission oversees the Area Agency on Aging and works in partnership with us to kind of advocate and raise up some of the, provide feedback on the implementation of programs. Advises, yeah, advises, gives recommendations. So the county is its own entity. We are bound by regulations from the California Department of Aging. So those are the rules and regulations that we need to follow. We, the county, need to follow. But the Advisory Commission on Aging sits along with us and helps to make, provides us input. Isolation is a big issue. Digital connections, the funding can be maybe used here. So helping us to identify future implementation strategies as well as maybe community partnerships opportunities. So I hope I answered that, but I can also explain a little bit more on the side if you have additional questions. Yes, Luna.
And I just wanted to add, it's a little bit more complicated. It's not one easy question to answer because it really depends on the various fundings that we have. So depending on the funding source that we have, there would be a different overseer.
Thank you.
Spectrum was mentioned. I've been a senior for a few years now. I haven't been able to access or hear of a lot of these services. So if this funding is going somewhere.
How do you find out about it? You're wondering?
How much use is being made of it besides them getting paid to have a job?
So the county, like I said, is a fair distributor of funds, and one of the processes that we have to go through is called a procurement process, which is a competitive bidding process. So multiple providers, we put out a bid, or we put out a proposal, or asked community-based organizations to give us a proposal on how they use those funds, and then we have a independent panel kind of decide upon that. So like Luna said, there is a process, and it depends on the funding source on how we get the funds out. So we are kind of what you would call the pass-through agency. We receive funds from the state, federal, or local funders, and then we go through a procurement process, and we identify community-based organizations or community partners to help us implement the programs in the community.
I'm sorry, Connie, we also have Spectrum raising their hand.
Oh, yeah.
Hi,
Okay.
I just wanted to clarify too, like Spectrum has a contract, right? It's a service contract. So we are actually only reimbursed for every meal that we serve, for every exercise class that we teach, and every client that shows up. So it's not like we just get a big chunk of money and it just goes to pay for overhead. We're reimbursed for every service that we provide. So it is
Service-based.
funding's a really complicated process, and I'm sorry you haven't heard from us, because we have some great programs. I hope when you get home, you'll check us out. It's spectrumcs.org. We have programs for low-income families too, help to pay your PG&E bill or your water bill, and we definitely try to get the word out. We're in those senior resource guides and the senior center handouts and the hard book that comes in the mail. But yeah, we need word of mouth to help spread awareness of all the programs that are out.
Yes, yes.
And we just wanted to mention that be sure to take your, we have these little gift bags for all of you to take on the way out. And included, there's some nice things in there, but also are the senior resource guides for your area that we hope that you will find helpful.
Before I forget, and I'm not trying to take up too much, I hope my questions are helpful. So since we're seniors, we're the most vulnerable group for being taken advantage of. And so I would like to know that there are more direct services and places we can go that are probably dedicated to us as seniors. that not everyone owns their home. A lot of us are still renters. And a lot of abuse is being taking place in the rental market pertaining to seniors and their housing. Grocery stores, these programs that they're asking you to join, you're not getting the benefits of joining them or the sales prices that they're offering. So I'm afraid that businesses in general and dishonest people who target us as a business, I'm afraid not much is being done where we can hone in to say this is a seniors line for reporting any such abuse. And I don't want, maybe there's a system already in place, but how about it being implemented? And if it's even just a system to give a poor rating, which affects them somehow on their business applications or their business funding from the county or whatever perks they get from the county. We need more consumer protection. I rented a car from Hertz, and the car was taken back the same day, and I still had to pay the full monthly rental fee. And this is something that was being done all over the nation with Hertz. And when I called the police, or when I insisted that they call the police, or other seniors like me, we were the ones that got abused.
I'm sorry to hear that.
So it's not just a scam from abroad where people are conning us as potential romantic lovers or whatever, from outside the country or whatever these scams are. But we need a place directly that we can approach, and hopefully the county as a body does something about it.
Yeah, you bring up a really good point with your questions. It's building that awareness of how can you navigate through the system and find the resources or the support that you need. One place that I would say that you can begin is to look at our county website. Most of us here work for the Social Services Agency, and we can connect you to local community partners, community-based organizations that have an expertise. And I want to point out that we have our local direct services providers, Janine, who's our social worker. She does information and assistance. Janine, do you want to tell a little bit about what you do and how you might be able to help?
Yeah, so basically, through the county, we have the county was the AAA, the Area Agency on Area Agency on Aging, and you're here dealing with the county-wide survey to improve services for you as we go into the future. But we also have other services such as the Spectrum services and the Meals on Wheels, and they are all contracted through state funding in order so that they can they kind of act as our arms. They reach out to the needs of seniors and people with disability and try to get them those services so people can continue to live independently at whatever level, because there's different levels. There's independent living, you're living in your own place, you're bebopping around. Some people are getting older, maybe they're getting a little forgetful, so they have to go into assisted living. Some people are getting really sick and they can no longer be alone, so they're in skilled nursing. So we try to do the whole realm. So basically what I try to do is I run a senior info line. We are trying to get the word out there. Basically, people call us and we just listen. We're not one of those that we really try not to just say, okay, here's the number, move on. Some people, that's what they want. That's great. Other people, they need a little bit of talking to. They need a little bit of hand holding, and because life can get really tough. So basically, that's what we do there. I answer the phones, and then my coworker, Diera, over there hiding behind the sign. She's our outreach person, so she tries to connect various agencies and places so that we can take that information and share it with our public. I hear what you're saying. It's not like all these resources are well known. How do you know? You used to have the yellow pages, food. You don't really have that anymore. So basically, what you do is you look and you listen. You go to your community libraries, you go to your whatever, and you look for resources, and you say, hey, what's that? And then that's one way to do it. The other way is you can do it through us, and please get our name out there. We're senior information. I do have cards I'll be happy to share with people. There's also 211 if you're really desperate for a service. 211 is another good resource because it covers everything all over the county for everybody. If you are if you are really concerned, if you feel that you have been abused physically, financially, emotionally, mentally, or you know of a neighbor or friend or family member that's being abused, you can call Adult Protective Services, and that number is 510-577-3500. They will investigate, and they will see if they can assist you in, in your safety, okay? The other thing is, if you are in physical harm in any way, if you think, oh, this person is coming after me physically, you can always call 911 and you say, I am in fear of my life, I am in fear of my physical harm, mental harm, and they will have, the police will do what's called a wellness check, and they will come out and check on you and protect you against that perpetrator, and then they will try to connect you with Adult Protective Services or whatever programs to best assist you. I wish there were, like, you got the 211. I wish there was more of a program like that. There was a hotline for just senior, but right now that's what we got. So it's really opening up, listening, reading, going on the internet and saying what the issue is, and what this is what my need, and doing some calling around. But for immediate, right now, we do have our senior information line.
Yeah, and if you want to get involved.
Oh, yes, the number for Adult Protective Services, and it's a 24-hour hotline, so you can call it any time, night or day. It's 510-577-3500. And the senior information is 510-577-3530. That's my number, 577-3530. More than likely, you'll get a hold of me, and you hear me talking now. That's exactly who I am and exactly what I do.
Yeah, this is a sample of what Janine offers. One of the many things that she offers is just listening and connecting people to resources, identifying, helping navigate through the system. Of course, building that awareness, getting that word out, how to reach her is also important. So thank you, Janine, and thank you for that's the first step, being here. I also want to say we are going to start to wrap up. This, again, is the Countywide Area Plan. This is your chance, our older adults' opportunity to give the county feedback on what has been working, what you would like to see in the future, what are some of the lessons learned. That's why we have some of our community-based organizations representing on as virtual guests. The last question I'd like to ask is okay. A very important pause. Is it okay with you if we do okay. So we're going to do our second raffle. Thank you for being patient.
I think we've only got one ticket in there.
Oh, I wonder.
Let's find
Did
out.
everybody turn in their tickets?
Yeah, everybody turn in tickets. Let's find out who it belongs to. 279627.
Bingo.
Who got it? Nobody got that one? What? Oh, okay.
She's the commission.
All right.
You know what? I think we're missing a ticket.
Yeah, I think so too.
There were 5 in there. Is there another one in there?
There's two. There's two.
We want to pull the other one, yeah,
Mm.
since I'm the commission.
Yeah. 279616.
Oh, yeah, that's me.
Oh, there you are. We have a second winner. Thank you, Laura. All right. Okay, so yes, do you have something to add to our previous question?
Yes.
Yes.
So
Yes.
I'm glad to hear that there are programs out there. Again, I go back to implementation and they're being effective. And I hear there's some implementation. Then my question is, I'd like for them to be more effective.
I like that. Hearing about how the funds are coming through, identifying or knowing about the resource, building that awareness, and also knowing of those services that are being funded or the programs that are being funded, how effective are they? What are the results? And that's part of the data piece that our providers, our service
They need to be
providers are required.
quantitated. And one of the ways of making them effective is that we don't have to rely on the agencies providing us the services for us to know where to report any concerns to. That should be given to us as part of participation in the program. If we have any concerns, here's where they get their funding, and we can voice them for accountability.
You make me think that you're an excellent candidate for an advocacy group or maybe even our advisory commission on aging. Any of those, it sounds like you have a lot of wonderful ideas and just getting involved and getting the word out and being a voice for others who may also who likely share the same concerns.
I often take care of others before I take care of me.
I know. And I would say the Countywide Area Plan, being able to complete that is an opportunity to give input.
Yes, you will find the survey in your, as you take your treat bags. I know that everyone online and in here has more to say about services for seniors to the county, and you'll get your chance. And that really dovetails very nicely with our very last question, is what is the best way to get information? Is it the newspapers? Is it phone? Is it the U.S. mail, or do you like social media?
Sure. The question again is, what is the best way for you and your family to find out about services and information? How did you hear about this program? How are you hearing about other programs that you utilize, or resources in the community, support opportunities, website, social media, phone, mail? Yes, we'd like to hear how you hear about us.
Oh, there you go. Yeah. Well, since I'm old, I like to say I like to go old school and U.S. mail.
U.S. mail. Yes. Hard copies, right?
Yeah,
right
I think for seniors, I'm more comfortable with that than I am looking on a screen. That's just me.
Yeah. Thank you for that.
I would also think the media, radios, TV. A lot of people watch TV. I mean,
radio, TV,
I just want you to know I'm on the countdown. What are we? 2 days away from the Medicare plan. You're closing, so that I don't have to listen to the commercials.
That's effective.
Yeah. So
you know the date
tomorrow. So yes, I would say
okay.
Media, TV, radio.
Okay. Traditional media, TV, radio. Yes.
Your healthcare providers, your bill, your PG&E bill. That one has to go through. More than likely, your bank.
So your providers, the
informational flyers in all those areas. Your bank, your medical providers, your dentists, your.
So informational flyers that you see posted in your bank, at your medical provider, your health clinic, your PG&E bill, just getting the word out so you can see it in anything that you may have access to or you touch. So thank you.
Online?
Oh, yes. Yes.
Hi.
Hi.
So I've had the most success with traditional marketing stuff. So the newspaper, especially the San Leandro Times and the Castro Valley Forum, they're delivered free,
newspaper.
to everyone's driveway. Anytime we've had any kind of publicity in either of those publications, we've had a huge outpouring of interest afterwards. Television, absolutely. And yeah, snail mail still seems to be a great way to, I think that will change as, aging is something we all have in common. So as people get older and are more comfortable with technology, then it may be more email and social media. But for me, I definitely see the biggest response rate through newspaper, television, and old-fashioned USPS.
Got it. Thank you. Thank you for sharing. Mail, television, radio, informational flyers found in public places, or even through mailers, or even through your PG&E bill. Newspaper. Yes.
Actually, I found out about this meeting. Someone had posted it on San Leandro Patch.
Oh. Newspaper, patch, San Leandro patch. So online.
It's a listing of different things that are going on in the community.
Ah.
That's how I found out about
There
this
you
meeting.
go. That's effective. Thank you for representing. All right. So I think we kind of already said mail, television, radio, newspaper. It could be, I don't know if anybody uses Nextdoor or online social media. Yeah. Just getting free resources, free access for those who are recipients of the information. Yeah. Okay, this is very helpful. Anyone want to just name their preference and why? I think already, Keith, you had mentioned mail just because you know it's going to come to you. It's just what you're comfortable with. Anybody else have any strong preferences? And we'll put a star next to that. U.S. mail. So these are the methods: U.S. mail, radio, TV. Free, just free, yeah. Anything that, free resources. Thank you. So free resources. Okay. All right. Well, again, thank you everybody for taking the time on this cold December day, rainy December day, and coming out here and providing us with feedback, very important feedback. We know you have even more to contribute, and we ask that you help us by filling out the Countywide Area Plan survey. I'm going to hand it off.
Now, I could go on a little more about the survey, which is in your bags, and we also have them available in other languages if you request it. But at this point, we need to put it to a vote. Do you want to hear me talk more about the survey, or do you want to hear another song by Mr. Keith Barros? I think the results of that vote were foregone.
Testing. Okay, it works. Well, this would just be kind of one of those songs that kind of hopefully makes you kind of look ahead and feel good about the future and play that funky music, white boys. On a clear day, rise and look around you, and you'll see who you are. On that clear day, how it will astound you that the glow of your being outshines every star you'll feel part of. Every mountain, sea, and shore you will hear from far and near, a world you've never heard before. And on a clear day, yes, on that clear day, you can see forever and evermore. On a clear day, rise and look around you, and you'll see who you are. On that clear day, how it will astound you that the glow of your being outshines every star. You'll feel part of every mountain, sea, and shore. You will hear from far and near a world you've never heard before. And on a clear day, yes, on that clear day, you will see forever and ever and ever and ever more. On a clear day. Thank you. Thank you very much.
Appreciate your time with us today. Take care now and goodbye.